Hi, everyone. Thank you for taking the time to come and watch my oral care education for my oral care compliance quality improvement project. So let's start with the basics. What is the problem? Oral care is the fifth most admitted patient ADL. It is the caregiver's responsibilities to assess and assist patients who are not able to independently complete such tasks due to change in their health and functional status. There are over 700 different microorganisms within the mouth. The oral cavity is affected by various things, including the enamel, diet, fluoride, saliva, microorganisms, and the immune system. It is important to treat this bacterial plaque because it is the primary cause of gingivitis as well as periodontitis, which will eventually lead to tooth loss as well as tooth caries. It is important to use proper equipment such as toothbrushes that are able to break down the oral biofilm that can disrupt the bacterial plaque because mouthwashes and mouth swabs are not able to do that. Consequences of poor oral care. Bacteria have the ability to travel from the mouth down to the respiratory tract and cause pneumonia. Non-ventilated hospital-acquired pneumonia is associated with increased length of stay, increased patient mortality, as well as a associated cost of about $40,000 per patient event. Patients with higher dental caries and missing teeth are also at higher risk for developing heart disease. And patients who have uncontrolled diabetes is associated with poor oral health and periodontitis. So I just wanted to provide some warning signs of dental problems to look out for. You want to look for any pain or swelling in the mouth, face, or neck, any sores that you see in the mouth, a change in the fit of a patient's dentures, any difficulty opening or closing the mouth or chewing, any red, swollen, or bleeding gums, which may be a sign of inflammation and irritation, gums that are pulling away from the teeth or receding, bad breath that is prolonged and unable to be corrected with oral hygiene, pus that you can find between the teeth or gums, any dark or discolored spots on the teeth, and any loose or broken teeth. There are several recommendations from the American Dental Association, one being to brush your teeth twice a day with fluoride toothpaste and a soft toothbrush for at least 2 minutes. You also want to floss daily. It's also nice for patients to limit the sugary foods and drinks. And for our patients who are on a fluid restriction or NPO, some dry mouth care could be using a alcohol-free mouthwash, sipping on water, or sucking on ice chips, not chewing. Denture care is also important for a lot of our patients. With dentures, you want to brush them daily, rinsing them before you brush to help get off any extra food that may be there, and you want to use a soft toothbrush so you do not scratch the dentures. Um, you also want to clean the entire mouth, including the gums, the tongue, the roof of the mouth, as well as the cheeks. So even our patients who have a couple of teeth and maybe not a full set of dentures, it's important to brush those teeth as well as the entire mouth. Whenever dentures are not in use, they should be stored within water in a denture cup at the patient's bedside. And there is also denture adhesives that could be used, which include creams, powders, pads, wafers, strips, or liquids. Documentation is also a big component of oral care compliance because we know that if it wasn't documented, it wasn't done. According to an article, Tessero et al. 2018, only 10.7% of patients receive the ADA's twice a day oral care. while 60.5% of patients had no oral care documented at all for 24 hours. So I posted pictures of where to find the documentation. You'll find it under iView and ADLs. The documentation should include the method as well as the solution. Please be specific in the documentation. Don't just include self-care or performed by patient. Try to include some of the materials used. Now for the project, you'll be seeing these signs on patients' whiteboards. I encourage you to fill out the date, engage with your patient. This sign could be used to help track oral care completion. So whenever it's done, you can use the expo markers that we use to update the whiteboard and, mark off morning or mark off the image to show that it has been completed, to have that visual reminder for you as well as the patient. Oral care champions are also another component of this quality improvement project. Any RN or PCA can become an oral care champion. What the champions are basically unit resources. They can provide encouragement to complete oral care, provide feedback, and help you with documentation. You can identify oral care champions by a toothbrush or toothpaste pin that they will have on their badge or scrubs. And here are some additional references if you want to refer to these. So thank you. Here is my contact information. Please contact me if you are interested in becoming an oral care champion. If you have any questions regarding oral care at all, or reach out to your unit manager. The project is anticipated to begin July 8th. So I will see you there. Thank you for your time.